my friend Letitia, she has a question. I want to actually hear that's a quick answer from all three of you all. And then I'm going to shift it to our next question. She asked a question about what is the average stay of inpatient psychiatric hospitalization for children and adolescents. So let's just start with you, Dr. Webb, just real quick. What do you see as the average stay there in Arizona? Yeah.
I'll tell you what it's supposed to be if you subscribe to a system like Milliman Care Guidelines or Interqual or something like that. It is
Mhm.
supposed to be 3 to 5 days, on the higher end, 7 days. That is what it is supposed to be. What we're currently seeing right now is that it is much longer than that, especially for children and adolescents who I would say are, in my case, who are in the custody of the state. Um, it is unfortunately much longer than that, because here in Arizona, one of the stipulations that we have is that if we have one of our kids in foster care that had to go to an inpatient psychiatric unit, and if we are not able to solidify and confirm an appropriate disposition with
Mhm.
appropriate outpatient services, then they
Mhm.
are to remain inpatient until that is done.
Wow.
So let's say someone went in for suicidal ideation or something like that, and let's say from a clinical psychiatric standpoint, they would have been cleared for discharge by day 3 or 4, meeting all appropriate standard of care guidelines. If we are not able to secure an appropriate discharge setting with appropriate outpatient services, that can tack on some time to their stay. And under that rubric as well is why we're having so many waiting to go to residential treatment, because it is felt that, okay, if that child has now been approved or identified for residential level of care, we can't then send them to a DCS congregate care home or to a foster family who doesn't have the ability to provide that intensive level of care. So to err on the side of caution, the system is waiting to do a hospital to RTC transfer to make sure that that youth continues to get that intensive level of care.
Gotcha. And that could take days,
Yeah.
weeks. Yeah. I didn't mean to say that. That really could take,
It can take
and
a long
it
time.
takes it.
I'm gonna say
I
that.
got you. I got you. So I want people to understand that there are so many different cogs, or if you would, or different factors. I'll use that word as to play as to how to make sure a child can get the appropriate care that is needed. Dr. Mitnaul, what's the average length of stay? Just quickly, what are you saying?
Yeah. Sure. I actually, Dr. Webb said, I think did such a great job summarizing. That's what it should be, but it ends up
Mhm.
being longer for those reasons. As she gave that scenario of a child who's ready to discharge from the hospital, but really they're looking for a great disposition in terms of kind of continuing care. And so I'm thinking, because of the phone calls that we get from the hospital, how quickly can you see this child? And if they're not already connected to care and need a new patient evaluation, I mean, that can be really, really long, and so you can see how that bottleneck, really doesn't serve the child's needs well, and certainly has the length of stay prolonged. So I think kids, and so the kids that I might see at our hospital that adjoins my clinic might be a slightly shorter length of stay. But that also depends on a lot of factors, including their custodial kind of circumstances as well, and the things that they need in order to be with their parents in the community. So prototypically, probably this time last year we would have been saying 3 to 5 days, but I'm sure it's at least double that, if not more, again depending on the circumstances.